know what to expect and I didn't know how to feel. And I had so many women tell me like, oh, you'll know when to push. Now that I've gone through the experience, I never knew it was time to push. My doula had to tell me.
Right.
So things like that, just like I appreciate that she has this program to, for women who don't have the luxury of being able to afford a doula out of pocket like I did.
Right.
Having a program that they can reach out to and a practitioner and just a fitness professional that they can reach out to that knows a lot about it. I appreciate the program. I think it's really cool.
Cool.
Okay.
Sorry to like stay just if we could like scoot a little closer, that'd be just squeezing.
I'll let you guys
that'd be
go.
awesome. Oh, I'll just switch seats.
Okay.
Cool.
Do you want me to make sure that it's like set up right?
I think it's good.
Okay. I'll let you guys
Thanks. All right. So just because we just started this a little bit, a couple minutes in, we're here to talk about chiropractic, about Webster, about BirthFit, about basically how you guys here at, is your practice called Bluebell Chiropractic? Because the website.
The website is bluebellchiropractic.com.
Right.
But we are Community Chiropractic Center.
Okay, so that's the name, Community Chiropractic. And we're on Swede Road,
Correct.
right here in Bluebell? Okay. So I just did a search. I just did whatever the Webster, I guess, website is.
Yes.
I went there and I just searched for practitioners in the area by zip code, and I'm pretty sure we're the only ones that popped up.
For the ICPA, the International Chiropractic Pediatric Association.
Exactly. Yeah, perfect. Love it.
That's a
Yes.
mouthful.
So I don't know a lot about your guys' history. I mean, we were talking about kind of where you were in Plymouth meeting first, now here. But do you guys want to give like a quick background as to
how we got here?
how you became chiropractors? And
well, I know I became a chiropractor. I had when I was in middle school, I started to suffer with migraine headaches. And my parents took me to my pediatrician, to pediatric neurologist. I had blood work, I had x-rays. Took a lot of different medications over the years, and none of them really got the migraines under control. It wasn't until a friend of mine in college who saw me having an episode of one of my migraines said, you should go to my chiropractor. And I very intelligently said to him, what is a chiropractor? And he said, oh, well, she fixes my back. And I said, well, I don't have any back problems. I have this knife-like pain in my head, lasts for a couple hours a day, 5 or 6 months out of the year. I'm seeing a couple doctors, I'll be okay. And then he said, well, she has a few brochures in her office that says that she deals with headaches, and she's really taking good care of me. You should at least come talk to her. So I did, and she did a chiropractic evaluation on me, and she said, I can see where you have some issues of alignment with your neck. She said in some cases, when the spine is misaligned, it does put extra pressure on nerves that can affect sensitivity towards headaches and certain types of migraines. She said, I'm not going to promise you that I'm going to fix your migraines, but your neck alignment is terrible and you should fix that. And I said, okay, fine. So we did, and my migraines went away, and they never came back. And now here I am. So that's my story, and I know.
I feel like that happens a lot, right?
Yeah.
People becoming doctors and nurses, like they have a personal experience.
Yeah.
And then they're like, I want to be a PT, or I want to be,
Right.
because they felt the impact.
Yeah, it was.
On that, right.
It was 10 years of my life. Like when we have patients now who come in who are in chronic pain, I can say, I can empathize because
Right.
that was my life for a decade.
Right.
So it's nice to be able to help people that way. It feels good.
Right. It's awesome.
Yeah.
And I really grew up with chiropractic. My mother's always been more of a, I used to say like crunchy granola,
Sure.
Yeah. on that, because she was somewhat atypical. She wanted us to grow up with a healthy back.
Mm-hmm.
So she took us to the chiropractor from a young age as just part of staying well and being well. That if your body, if your nervous system didn't have stress on it, if your alignment was good, that it would help you to be healthier, help your body function better.
Mm-hmm.
So I really grew up going to the chiropractor.
Got it.
And when I got older, I knew I wanted to do something in the medical realm. So I looked into nursing, I looked into physical therapy, I looked into chiropractic, and I went to work for a chiropractor. And it was in working in his office. I just went in one day and said, you know what, I'm interested in this. Can I volunteer in your office? Just to learn more about the practical side of being a chiropractor. I've been a patient, but I want to see what it's like. And it was incredible seeing how he was able to help people who had been through, just like Mark was saying, you know, the gamut of doctors and still suffering, and he was able to help them.
Yep.
So.
I love that. And did you guys grow up in the area?
No, we're both
New
from
Jersey.
New Jersey. Yeah,
Okay, I am as well.
Yeah, yeah.
I'm Bergen County.
Oh, nice. Yeah.
Okay.
Yeah.
All right. I'm Middlesex County,
I'm
and
from
he's
Camden County.
Got it.
So,
Okay. And then how did you guys meet?
chiropractic school.
Yeah.
Through school. Okay,
Mhm.
got it.
Yep. I went all the way to Georgia to meet a guy from Jersey.
I love it. Yeah, that's usually how it happens, right?
Yeah.
Mhm.
Seems like everybody's from New Jersey. So you were down in Georgia, and then what? You both wanted to move back up to the area because of family and whatnot?
Yes. Yeah.
Okay.
And we had an opportunity. One of my coworkers was moving back up here. He and his wife were also chiropractors.
Mhm.
His wife was from Pennsylvania, and they said, "Oh, there's a couple practices that are coming up for sale." So they bought one in Bucks County, and we bought this one in Montgomery County. And I think if we had to do it again, we probably wouldn't buy a practice that we didn't work in ahead of time. Like
Right.
that was quite a learning experience, but it
Mhm,
was
mhm.
good. It got us up into the area. We're closer to family, and in the end, it was a good thing. But
Right.
Mhm.
yeah, but that's how we got here. So.
Got it. So talk about, because not every chiropractor is certified in Webster, which is kind of the focus of what we're talking about.
Right.
So what are those differences? What's the, kind of how is it different than general chiropractic? What kind of considerations, or what makes it Webster, right?
Well, what makes it Webster is just the approach and analysis to the pregnancy patient. And honestly, it doesn't have to be just pregnancy. The analysis can be done with anybody. If you've got, you know, a lumbar spine, hips and pelvis, you can.
Which most people do,
Most
right?
people do,
Yep.
exactly.
Mhm.
You can utilize the technique, and it draws from Logan technique and other chiropractic techniques, which people probably aren't that familiar with. But Webster himself, you know, he was a practicing chiropractor, and he had a daughter who had a very traumatic birth. And I forget how long she was in labor, and he just felt that there could be something better for the pregnancy patient.
Mhm.
You know, obviously his daughter was a patient of his, but he felt like, okay, there needs to be more analysis into this. So he really drove down on it and kind of developed what has become to be known as the Webster technique. And it utilizes a lot of analysis on biomechanics of the hips and pelvis.
Okay.
Not only the bony structure, but also the soft tissue structure, the ligaments, the tendons, the muscles, and helping the mother so that there's room for the baby to move and turn and move into the natural position, but also helping the mother with just comfort
Mhm.
during
Yep.
pregnancy, because there's so many physical changes during pregnancy that if it's your first pregnancy, you don't know what's coming for you, and
Right.
everybody's different. So it's a technique and the analysis of it and the application of it to really just help bring forth less pain,
Right.
better birth, and recovery too.
Right. So postpartum too. That's not like it just
Exactly.
stops right postpartum or at pregnancy or at birth, right?
Exactly. We kind of call it the fourth trimester,
Mm-hmm.
because after birth, there's, you know, everybody's so focused on that, and that moment happens, and it's great. Okay, mom and baby are okay, and then it's
Yep.
all hands off, and
Yeah.
then
And
that.
get back to work. And
Right.
Yeah.
And the work is just
It's
beginning.
ridiculous. Yeah.
Yeah.
But it is, and there's still so many physical changes that happen for a mother
Mm-hmm.
after the birth of the baby, and then caring for that baby. You know, I kind of call it mommy back, because we get a lot of patients who are, you know, they're nursing the baby, they're picking up the baby, they're walking around with the baby, and they just
Yeah.
get this.
Mm-hmm. And when they get older, they're on the one hip, and the
Right. Yeah.
Mhm.
Absolutely.
different carriers are going to
Mhm.
be asymmetrical. And
Yeah.
Right, always holding it on your non-dominant side, so you can use that to, you know,
Right. Do other
text,
stuff. Open
phone.
the door and yeah. Right.
Yeah.
Yep.
Yeah.
So it is, but the technique itself is an analysis and
Got it.
an application of chiropractic adjustments and maneuvers in order to just bring the best alignment possible
Got
to,
it.
to the mom.
So, let's say, because we have a few expecting mothers,
Mhm.
and then a few just postpartum. And I'm assuming that you would recommend chiropractic for the general population, otherwise you probably wouldn't be in the field, right?
Right.
At what point does it become general chiropractic, and then kind of does it switch to Webster focused techniques, or is it always that case? I'm only just learning about this now, so
Yeah.
I don't know. Like, let's say someone's already seeing you, right?
Mhm.
And then they come in, they're like, "Hey doc, I'm pregnant," right?
Mhm.
Do things change then? And then for how long? What's that process?
It's more looking at what symptoms they're presenting with.
Okay.
So as noted
Got it.
before, the technique, the Webster technique, doesn't just apply to pregnancy. Like, you don't have to be pregnant
Right.
for it. But if someone presents to us and they say, I'm having this type of discomfort, I'm having this problem, you can utilize the technique to align the hips and pelvis.
Gotcha. Okay.
Yeah.
So it's more about things related to the pelvis that may be useful. Like, you use right tool for the right problem, right?
Correct.
You're using that technique for something related to the pelvis.
Mm-hmm.
Yeah.
It's not just about pregnancy,
Right.
but obviously because pregnancy has so much to do with the pelvis,
Right.
there's a lot of overlap there.
Exactly.
Got it. Okay.
Or if mom will say, the baby's not presenting properly, like that might be a time where we're really focused down on.
Got it. So would this be for like a breech baby?
Correct.
Okay.
Mhm.
Got it.
But I will say a lot of the times, if people are under regular chiropractic care, their spine has the mobility already that allows the baby to get where it needs to go.
Mm-hmm.
I think, speaking in generality about the population, because over the last decade or so, maybe even more, we've become such a sedentary population. Like,
Right.
we sit at desks to work, we text each other, on phones. We don't move, and people don't realize how much of their mobility that they lose. So when, let's say, mom isn't real active and she has a desk job and she gets pregnant, her spine might not be capable of, and her hips and pelvis, of actually getting into a position that allows the baby to comfortably make the transition into the right position. So
Mm-hmm.
hopefully our patients who have been under regular care, they do have that mobility, and very rarely do we need to deviate from just standard stuff.
Mm-hmm.
But sometimes when people come in and maybe they don't have good spinal mobility for whatever reason, and they need a little help, sometimes you might have to get more directly into more of the Webster technique right away. So.
Gotcha. If you had to put like a general percentage on, how much or how many times you kind of use that,
Mm-hmm.
is it much? Is it 50%? Is it 30%? Is it 10%? Is it?
I don't know if it's able to be quantified like that, Chris.
Yeah, okay.
Because there are it's not just one procedure for the technique.
Got it.
There's different tangents from it based on the presentation of the patient and what's going on. So I utilize quite a bit of it in parts
Gotcha.
when doing adjustments
Okay.
and doing an analysis on any patient.
Mm-hmm.
So a good percentage,
Right.
but not in totality of
Understood.
the technique as presented, on the
Right.
surface.
Yeah. It kind of blends in and blends
Yes.
out. Yeah. Okay. Got it.
Yes.
Chiropractic in general, how often are you seeing people? How often would you recommend people to see a chiropractor? Let's say they're, for us, we have, soccer moms and dads. They're working out 3-4 times a week, maybe 5 or 6, but those are people who are doing pretty, a lot more consistent. So how, what would be your general recommendation for chiropractic? Because a lot of people listening or watching this, this is really their first time kind of even hearing from a chiropractor.
Well, it depends on the presentation. If someone comes in with an acute problem, and we put them through a protocol like that, they may be here a couple times a week for
A short period
for
of
6 to
time.
8 weeks maybe. If
Mhm.
someone I have acute low back pain, it affects me every day, or my leg is numb, that type of program we'll do. And then we'll release somebody from that type of care. But for general maintenance and wellness, to maintain good alignment and good mobility, which are essential for long-term health of your spine. Our standard recommendation for a typical person is to come in once a month. That would help you maintain your mobility, it will help you maintain your alignment. And I know to the uninitiated, sometimes people hear that and they're like, wow, that's crazy. But we tell people...
That's actually less than I thought you were going to say.
Well, it's easier for us to maintain, like, is it easier to stay in shape or to get in shape? You know, like,
right.
The same is true with chiropractic. And the same,
Gotcha.
like, we use dental analogies all the time. Like, you know, you don't wait till you're pretty sure your tooth is going to fall out to go see the dentist. Well, most people don't. But people do wait till, like, well, you know, I thought this was going to go away and it's been getting worse and worse. They will wait till they're in a crisis to get their back taken care of. So,
Gotcha.
Which we're not trying to be judgmental about that. That just
Sure.
it's the social norm.
Sure.
But it would be we would be a lot healthier if it wasn't. And as chiropractic as a profession, we're really trying to educate people. It's not necessarily about pain, but it is about proper mobility and alignment, and getting things to work properly so that you can have a nice, long, healthy life.
Even once you reach a fitness goal,
Mhm.
you have somebody, they have a fitness goal, and they come in and they undergo a program and they reach that program. Okay, how do they maintain that? You know,
Right.
they need to do something to maintain it. It's not like you get there, okay, and that's it.
Right.
I'm
Okay.
good. I'm
I'm
golden.
gonna stop.
I'm done. Yeah.
Right.
Right.
Wouldn't that be great?
Right.
You know,
Yeah.
if you could go to the dentist for your cleaning,
Yeah.
get your teeth checked and cleaned, and then like you're golden for years.
Yes. Yeah. So there is a maintenance phase, but obviously
Yeah.
if someone's coming in with an acute problem, then
Right.
you're gonna see
Right.
them more often.
Correct.
That
yeah.
totally makes sense.
Yeah, but I think somewhere out there, there's like, they're going to want you to come 3 times a week forever, which, you know, if we like you, sure, great, it's nice
Right.
to see you all,
Yeah,
but,
exactly.
but, you know, we do, like, if there's an acute issue on the table, we try to handle that and then get people to wellness. And really, a lot of our practice is about education because as we're having this conversation, like, a lot of people are just really unaware of that. You know, they're just like, oh, well, people will say to us all the time, oh, you guys are chiropractors, that's great. I've never really needed one because my back doesn't hurt.
Mhm.
And, you know, you just kind of acknowledge, like, oh, okay. But the reality is we all need chiropractors, like, we all need regular exercise, like, we all need to eat good, healthy food, like, you should get your teeth checked. Like, anything that is worth of value requires some maintenance, and your spine is definitely one of those things. So.
Got it. What would let's say someone's not local, but looking for a chiropractor, what would be your kind of recommendation for what they should be looking for? Because obviously, if they're in the area, you know, you want them to come see you.
Right.
But let's say someone's out in California,
Mhm.
right, and they're like, oh wow, I think I should see a chiropractor. They're gonna Google search, 50 places are gonna pop up.
Mhm.
How do you choose, right? Besides just Google reviews.
It's a good question, and we have patients actually, 2 who were out in California recently, one who moved out there, and then one who was visiting at Christmas who came out and said, oh, I need to find a different chiropractor
Yeah.
out there.
Mhm.
And one of the best ways is through talking to friends, talking to family. Who do they know in the community? Who do they go to? Because you really get more of a sense of an actual practitioner's abilities and comfort level with the community from that versus Google page. 'Cause
Right.
you can have a great website, you can have, you know, fantastic ratings and
Mhm.
5 stars, but
Mhm.
really it's not the right fit for the individual. So just conversations, asking for those referrals
Got it.
is probably, I would say, the best way to go about it. There's not like there's
Yeah.
one website.
Well, but are there techniques that you would look for? I mean, there's the DC, obviously you want to
Right. We look for that.
clearly, right? But
You know, sometimes we'll actually call chiropractors for patients. I know, like, we know what kind of chiropractic that we do here, so I would know what questions to ask. Let's say you were a chiropractor in California. I'm like, oh, do you do hand adjusting? Do you do instrument adjusting? Do you have this type of a table?
Okay.
Like, what's a typical treatment protocol? And it's hard to, I think what Dr. Kristen's saying is very true, because one of the things about chiropractic is it's not really always standardized. Like,
Mhm.
and it doesn't mean that our way is the best way, but the chances are, let's say, a lot of people from the CrossFit box, if they're comfortable with a chiropractor locally,
Mhm.
And other people who go to the box are like, I'm looking for a chiropractor. If they're of similar mind and similar lifestyle, they're also going to think this person's okay.
Exactly.
Like there's a chiropractor down the road from here who is like, she's very holistic. She does a lot of energy healing. She's wonderful, but she's like 180 degrees different than us. So I think if somebody who was used to our practice went there, they may do fine with it, but they would be shocked.
Right.
Because it would be very different from what they got. But we both have the DC after our name.
Sure.
So,
yeah, well, my background is in counseling, high school counseling, and talking with the high school kids about college choices, I say, about a CrossFit gym, or even just a fitness facility. It sounds like for chiropractic facilities, it's like picking a college. Like, you're all there for that reason of getting an education, but every campus is going to feel different. It's going to be different sizes. It's going to have different things about it. There's no right answer per se, but it's about fit. And so, we recommend people go check out all different places, because you should be at a place that you feel comfortable at, that you're at a baseline getting the services you pay for, right? At a baseline. But, places that are going to keep you safe, make you feel safe, educate you. I think education is super important, right? Because if it was just a robotic service, well, robots could do it, right? But it's a human service. It's a service-based business.
Exactly. And it has to be the right fit, or it's just not going to work. And that will become evident. And anything like that, it's quite an investment of your time, your energy, or even your money. And you want to make sure that it's right.
Yeah, from both sides too, right? It's not just the consumer looking to buy. Like, you guys, I'm sure, have to feel comfortable having this person walk in and lay on your table, and if you don't ethically feel like it's a great place for them, like.
Right. If we truly feel that we can't help them, we'll let them know. If this is not the right practice for you. Right. You would probably, and we'll try to guide them if we feel that we have a resource we can refer them to.
Yep.
But we've had that happen.
Yep. Yeah, same. Is there anything else that you would want people to know about either chiropractic or Webster? I've learned a lot, so at my level of actively looking at information, this has been super useful. But there's a lot of people out there, including our own members, that had no clue that this even existed, or that they should even think about different techniques versus just going to a general chiropractor.
Well, perhaps one of the things is we have the ability, sometimes people are a little concerned about manipulation and adjustments. They're shy away from that. They're like, I could never do that. I don't want that. So there's different ways and different things that we can do that do not involve manipulation.
And that's the cracking or not cracking. Or,
Exactly.
Yeah, because we have one member who hates the cracking. She doesn't, so she sees someone that doesn't, but then others are all about it.
Right. So we have, in the practice we can do adjustments by hand or manipulation, but we also utilize tables that facilitate doing the adjustment, as well as an instrument, an impulse adjusting instrument that we can utilize to do adjustments and perform alignments without that.
That is in the corner?
Well, that's actually therapy. It's an electric muscle stim.
Okay.
So that's more of like the physical therapeutic side of things versus the adjustments.
I'll grab the instruments so you can see it.
Yeah, it looks a little intimidating at first, but it's just an impulse. It gives a light impulse.
Okay.
It impulses up to 12 times per second. Now, the benefit of that is that it can impulse just faster than your muscles can react, so it's helpful in overriding muscle spasm, hypertonicity of the muscles.
Got it.
Yeah, it's great. It can pulse as light as a few ounces. So sometimes if we're working on like the ladies, sometimes after they had a rough birth, we'll use this, all the way up to like somebody who is just really big or really tight. Or sometimes if people come in acute pain, like we can't move them around because they're in so much pain, but we can apply the high-speed instrument to the area, start to adjust the joint that way, and it gets them started off. So it's a very useful tool. So, but I think it's also very comforting to people who are nervous about hearing the cracking sound, because a lot of people are. They're like, oh,
right.
Like, and it's amazing. So,
we also have a table in here we can show you if
Yeah.
if you want to take the show on the road, so to speak.
Yeah.
It's called the flexion distraction table,
Okay.
and it has an abdominal piece that will drop away. So, and we
Okay.
have pillows and such. So for our pregnancy patients, we can accommodate them.
The belly.
The
Yeah.
belly,
Yeah,
yes.
exactly.
That's
Yeah.
the best.
So they're able to lay in the prone position or lay face down,
Right.
and it
I love
does
that. That's awesome.
an easy decompression with
Gotcha.
the lower back. Very healthy, not only for pregnancy patients, but for anybody who has disc issues in their low back, which is just a few people.
Yeah, absolutely. I definitely want to see that. Maybe I'll just take a picture and put it in
Sure.
the video. You had said something that maybe you want to reminded me that I want to ask it. So, when I went to the birth fit coaches seminar, this was 2 years ago now, I want to say. That was the first time that I even heard that babies or children would get chiropractic.
Mhm.
I had not known that. So can you talk about that? Because I think that's something that not everybody realizes,
Yeah.
that infants, babies could and probably should get chiro.
Yeah, I mean, well, obviously, when we were speaking with Kristen, our practice rep earlier, she had her son's not quite 2 yet,
Mhm.
so I think her birth experience is fresh in her mind, but the act of actually pushing the baby through the birth canal, like, it's intense. And sometimes the baby's neck and spine are under some stress during that. And there's very gentle ways to realign the spine so that it's moving properly. In fact, we're working with a young lady right now who is 8 weeks old, I think. And she has what they call infantile torticollis, where her head's kind of stuck to one side. So we're working to free up the vertebrae and just some very light stretching with her and some instrument adjusting on her neck, and just to try to get that mobility back, because she had that happen. And someone had sent or put a video out online. It was on a chiropractic website. It was great, and I don't think it initially was intended to be a chiropractic video, but in the top of it, it says "Kids need chiropractic?" ? And it shows a bunch of toddlers and all the stuff that they crash into and all the falls that they have. And by the time you're just laughing, like, of course they need chiropractic.
Got it. Yeah.
So just for general maintenance, yes, and not as frequently. Like, we typically don't see kids once a month, but maybe once or twice a year,
Gotcha.
because their spines are a lot more mobile, unless they have an incident. And there's other cases where we had a case a few years ago. The young man who was having a really difficult time with ear infections. And his mom actually was a patient here already, and she said, "I read that chiropractic can help with ear infections." And I'm like, well, sometimes yes, it depends. If it's caused from a misalignment causing compression to the right nerves, then it can help. I said, but we need to see each case individually. Well, she said, well, he's scheduled to have tubes put in, and I would really like to at least have him try this first. So we said, oh sure, okay, let's check him out. So he definitely needed some adjusting, so we did that, and he never had an ear infection again. So yeah, and again, we try to caution people, like, we are not the cure for ear infections. It really depends, but yes, it can be helpful for that stuff as well.
Taking stress off of your spine, your nervous system, your nerves, it's never a bad thing.
Yeah.
Right.
So that's like one of the last questions. Is there anyone out there that shouldn't get at least a consult or see a chiropractor?
If you've never had a checkup, you should.
Right.
And if it's been a while since you've been to one, it's, again, kind of like dentistry. You wouldn't think about not brushing your teeth every day or about going to the dentist at least somewhat regularly to keep on top of things and be proactive and help prevent things. So even though you may not have pain, it doesn't necessarily mean that you shouldn't. Yeah, there's one of our pediatric patients up there.
Oh, super cute. First adjustment.
So.
I love that.
Yeah, and a lot of times we'll also hear, like, oh, I had spinal surgery, so I can't be adjusted. Well, there's 24 movable bones, and if you had particular surgery that would warrant us staying away from it, we'll stay away from it. But there's a lot of other bones that do need attention and help as well. So some people have a fear of that or a misconception of that. And then the other one we frequently hear is, oh, I have a herniated disc. I can't see a chiropractor. Like, no, you have a herniated disc, that's probably why you should see a chiropractor. There was a great study that came out in Spine Journal a few years ago about that, and said if you have a herniated disc and your starting off point is an orthopedic surgeon versus your starting off point being a chiropractor, your outcome is relatively speaking exactly the same, but you're 75% less likely to have surgery if you start with the chiropractor. And while chiropractor is a little more time consuming, and that maybe you are coming a couple times a week for a month or two versus just a one-off surgery, there's a lot less long-term change to getting adjusted and properly aligned than there is to having that spine.
Yeah, and obviously
surgery.
less invasive and
Right,
probably
yes,
cheaper and
yeah,
over
it
long
is.
term.
Like,
Yeah.
I think they said I may have this number wrong, but I think the average cost of a spinal surgery is $10,000. You could come for a
Oh, I
lot
would
of
totally
chiropractic
believe that.
visits,
Mhm.
before you hit anywhere close to that. So, from an economic standpoint and invasiveness standpoint, it's a good option to at least explore. The worst thing I tell people that could happen is that 6 to 8 weeks from now, you're still in a lot of pain and you go back to the surgeon and have it done. But at least you gave it a shot. So.
Right.
Right, we can't guarantee that, a person's symptomatology is gonna go away. But we do work to make their spine, their back healthier, so that it lasts them a long time.
Right. Yeah, I love that. Great. I think we can end that there, and maybe
Okay.
we can go see the table.
Sure.
Yeah,
Okay.
absolutely.
Great.